Hello viewers, I am Dr. Sharat Megh and I am a consultant pediatric dentist at Bhagirathi, Neotia, RAWDON Street. Most of you have already met the pediatricians and the gynecologists at this hospital, and you have been referred and informed about the proper care that you need to take during pregnancy. Today I am going to tell you about pregnancy and oral health. I am sure you have been informed about maintaining your oral health by your pediatrician and gynecologist. But there are certain aspects which are usually ignored or just plain forgotten. I am here to tell you what you are missing out on. Mother is the primary educator of any family, be it the child or the family. They suddenly start learning from the mother, and oral hygiene plays a role. There are numerous articles which tell you about how improper oral hygiene spoils and affects raising birthing issues like low preterm birth weight, preeclampsia, and there are slightly more others. Reasons? Please consult your gynecologist and pediatrician, but there has been a link between that. I assure you that all the treatments as of 2021 are now possible. There are guidelines now stated by the American College of Obstetricians and Gynecologists as well as the American Dental Association, which have stated that all treatments are now possible, immaterial of which trimester you are in. But yes, safety is our concern. We take care and pride in deciding the treatments which are required for you. Now, when we talk about pregnancy and oral health, we know that as we know, oral hygiene plays an important role not only in your self-health maintenance but also your child. See, you have been told to brush twice a day, you have been told to floss, you have been told to maintain your proper oral hygiene even after your morning sickness. But there are certain tips which a lot of people tend to forget. See, after birthing, what tends to happen is the whole family and the mother is more busy with the child rather than with themselves. They tend to forget most of the instructions given even by the pediatrician or your gynecologist. What I am suggesting is meet your dentist even before the birth happens. That way you are informed and you are knowledge. You can acknowledge the knowledge and be ready for what happens after the birth, so that you know that how much of an important role oral hygiene plays in not only your health but also your child's health and your family's health. The overall well-being depends on your oral health. Brushing twice a day does help, but when do you brush? That matters. Morning sickness is something pretty common in most of the pregnant ladies. Now, after morning sickness, after you vomit, there is a regurgitation of acids. As it is, morning when you wake up from your sleep, there is a lot of acidic activity in the mouth which causes your teeth to demineralize. The vomiting increases the chances by almost 30%. Now, if I tell you that there is a way to control your demineralization of your tooth, if I tell you that just a normal mouthwash with saline and a little bit of baking soda can actually reduce the acidic content in your mouth before you go on to brush your teeth, wouldn't that help your teeth to be much more healthy? Wouldn't that help you to maintain a much better oral hygiene? Even one thing which is also most regularly forgotten is that there should be regular planned visits to your dentist. ADA and DCI, we all recommend it. All dentists recommend a bi-yearly visit. Once every 6 months, visit your dentist. You need not get any treatment done. All you need to know is that just have a look at your oral hygiene. Know that you are in a perfect condition. Know that your child is in safe hands. According to American Dental Association and American Dental Academy, we are taught, American Academy of Pediatric Dentists also tell the same thing. The first visit of any child is always within the first 6 months or within the first year. More importantly, once the first tooth erupts in your oral cavity, that is when the child's first dental visit should be scheduled. That way, we tend to create a dental home. When you visit before giving birth, we tell you what are the proper terminologies to be used with any child. What terminologies make the child fearful? What terminologies help the child, help the dentist to treat the child in a proper manner, so that there is no fear involved, so that every treatment can be a happy treatment. Every single sitting, every single visit with a dentist helps better your oral hygiene, following which an overall health improvement is seen. You should also know that after birth we tend to kiss your baby on the mouth. Did you know that if you have cavities after birth, that kiss that you transfer to the baby actually transfers a lot of bacteria, cavity causing bacteria, which can lead the baby's oral hygiene to deteriorate from the moment the first teeth of the baby start erupting. It is important also to note how many times you feed or till what age you feed the baby. Everything decides how in future your child is going to face or maintain their oral hygiene. Please do come and visit us at Bhagirathi, Neotia, RAWDON Street, so that we can help you keep your oral hygiene as well as your child's oral hygiene in proper condition. Thank you.